Some changes in healthcare feel incremental, and others, it shakes the ground beneath us. So last week at Epic's UGM, the buzz wasn't about small upgrades. It was about some seismic shifts that were happening. And for the first time, we're starting to see AI systems that just don't analyze data, but they're acting like integrated partners. And just like Epic's UGM was eye-opening to how this technology is weaved into a full tech stack from top to bottom vertically, the release of ChatGPT-5 is the catalyst to bring big changes in the way that we, the public, interact with technology. Now, why? It's because it pulls the pieces together. The final 6 use cases for AI have been combined because of this change. I'm talking about retrieval augmented generation, code generation, image understanding, speech recognition, multimodal reasoning, and agent-based interactions. I've combined these because this is the way we're working with AI. It's not just AI as a tool, it's AI as a coworker. Hi, I'm Tracy Yunkin. I'm a health informaticist. I've trained executives, I've led AI pilots, built smart on fire applications, and I build out data governance systems. Today, we're going to show you how ChatGPT is actually changing the game for everything. So up until now, each AI innovation that's come around has been a piece of the puzzle. RAG was like giving AI a library card. Code generation was like giving it a pen. Image recognition gave it eyes. Speech recognition gave it ears. Multimodal reasoning started to connect the dots. And agents, it made AI act on your behalf. GPT-5 is the moment that the puzzle locks everything together. Think of it like this. We've been training individual musicians. ChatGPT-5 is the orchestrator conductor. It's bringing everything into harmony. Going back to Epic's UGM last week, we saw the tremors of the shift. Ambient AI scribes, they're just not pilots anymore. They are production ready. They are freeing doctors from clicks. Imaging analysis is moving from assisting the physician to recommending next steps. It's cross-referencing labs against PubMed in real time. Clinical coding, it's not just automated, it's contextual. And that means it's reducing denials, it's speeding revenue cycles. Those Epic demos showed us that GPT-5 isn't theory, it's live and it's working, and it's already shaping clinical workflows. So let's talk about RAG, retrieval augmented generation. That's AI's way of looking things up before it answers. It goes to your knowledge base. So instead of guessing, it's double checking. It's like that resident who's always pulling out the latest guidelines before they speak in rounds. Well, that's what makes ChatGPT-5 safe enough for healthcare, right? Like those processes. It's referencing today's evidence, not last year's knowledge. Here's the contrast. What used to take weeks of chart review now takes seconds. What used to take a team of coders can be drafted instantaneously. What used to be siloed, right, like those notes, images, labs, research, can now be reasoned through together. And that's why GPT-5 just isn't another release. It is truly a tectonic plate shifting beneath how we work. We need to understand it and to use it. Multimodal reasoning means AI can look at a scan, listen to the patient's voice, and it can connect it to all the labs in the family history in one conversation. If you have an agent-based interaction, it doesn't stop at recommendations, it actually acts upon it. It schedules the follow-up, it codes the visit, drafts the patient handout. This is AI moving from a passive tool to an active team member. So what does it mean for you? If you're a frontline clinician, it means less time clicking. It means more time connecting with your patient, like what you went to school to do. For executives, it means that you're going to be reevaluating those ROIs. These are going to be different measurements. It's going to be less denials, quicker throughput. It means happier staff and patients. What does it mean for us? It means that we are safer and that we're getting more personalized care. GPT-5 is not something to fear, it's something to learn how to use, because those who adopt it early are going to be the ones who are setting the new standards of care. Now, everything we've talked about, RAG, code generation, image understanding, speech recognition, reasoning, and agents, they've all come together in GPT-5. So it's not a tool anymore. It's starting to act like a colleague. For you, whether you are a frontline professional or a patient, the way that we start to connect these dots in healthcare, it's shifting beneath our feet. Now, I don't want you just to hear about this. I want you to actually try this. All right, so now I'm going to show you how to use ChatGPT 5. How do you know that you're in ChatGPT 5? You click up here onto this caret. You'll see that here are all the tasks that it can do. And then you also still have access to these legacy models. This is something not for today, but I do cover in my YouTube channel and in my community. So when you come to ChatGPT 5, it's asking you, what can I help with, Teresa? And in here, we're going to put in the prompt that we had been talking about. So that prompt is, and I'm using all my own data from my continuous glucose monitor as well as from my fitness ring that I'm wearing, but I do cover over on my YouTube channel. So you see here, right? Hey, Teresa, ready to dive in. I love the personalized messages. You can also set that in the settings. Now we're going to put in the prompt we're using today. You can copy it right off the card. My wearable shows a sleep score of 89, and that is directly from my app. My glucose 130 after my great barbecue dinner last night. And my energy level this morning was 87. I've filled in these numbers. The next sentence explain how these numbers connect, research the correlation, then give me 2 tips to improve my energy. I know the grammar isn't right, but for me, it gets the point across and the AI doesn't care. Let's get started. You'll see it's thinking, searching the web, doing research, and bringing back all this. Hey, Teresa, love the data. Let's decode this energy puzzle with no sugarcoating. The pattern of speech is personalized. I don't like fluff or flattery. It gives my data breakdown, sleep score, post and glucose level, next day energy. What does this mean? If you look here, it is referencing sources that it searched. Wikipedia, Healthline, those are reputable. I'm connecting the dots. Sleep and glucose, quality sleep maintains insulin sensitivity, stabilizes glucose levels. It's giving me evidence-based studies, places I can go read, like blog posts. It's telling me why we're connecting the dots here. My glucose spikes the next day energy. Circadian rhythms are important because I travel across 3 time zones. It's telling me its thoughts about those numbers and 2 tips to amp up my energy this week. Here are 2 actionable experiments to try. So first thing, try a post-dinner walk, just a little one, 5 to 10 minutes, about 60 to 90 minutes after eating. At times of India, I would go to for a resource balanced dinner, what's on my plate, depends on the author of the article. Seems to be like this website. My sources have changed each time, just to let you know. Quick reality check. I'm in a solid spot, looking good. We can layer in CGM data, continuous glucose monitoring data, sleep, deeper sleep metrics, or hormone timing, insulin hormone. So my TLDR gives it to me here. I love this. I'll stop and I'll show you another one I generated that was very interesting. So remember, every time you run these queries, you may get a different answer. You can ask AI, what's the best answer based on what you've provided to me across these 3 different conversations? Again, that's something I'll cover on YouTube because it is a setting that you need to set. I'll go to my past chats. Here are my past chats. This is one I got yesterday. Do you see the difference? But this one gave me a recap table. Interesting. Look at all my sources here. This one had deeper research than the other one. AI, of course, I think has said, "Oh, you ran it again. You didn't like these." So it came up with different ones. All right, guys. Well, there you are. That's how you can pull data together with research to help you understand what all this deluge of data is that we have available to us. But I have to tell you, AI is one way to use this data amazingly. Do you see what's happening? You're not just getting generic advice. You're watching AI pull patterns across sleep, glucose, and energy, and going at the internet to see the newest studies. It's 3 things that most systems have never been able to connect before. That's embedding. That's multimodal reasoning. That's agents. That means working together right in front of you. And this is why I'm building a community on YouTube. If you want to go hands-on with GPT-5, not just understand it, but use it to improve your career, subscribe and join me. The seismic shift, it's already here. It's happening, whether we want it to or not. Most employees are already using it. Learn it first, be a better leader. Hit subscribe, ring the bell, and get the next episode. Thank you for joining me. This is the end of our AI summer series. Why? Because Labor Day is happening this week. Join me again here next week where I'm going to have an exciting announcement. I'll catch you guys here on the flip side. Enjoy the last long weekend of summer.